Authorities in Singapore say it will take at least 3 to 6 months for the country to reach a new normal. Now, this forecast follows a tightening of COVID-19 related measures there to slow community transmissions and to ease the potential burden on hospitals. For more on the situation in Singapore, I have Professor Teo Yik Ying at the National University of Singapore. Professor Yik Ying, it's a pleasure to have you with us.
Very nice to be with you. Thank you for having me.
Right. Professor, let's begin with the surge in daily tallies there. Amid an ease in social restrictions back in August, I believe authorities have been recording over 3,000 new infections on a daily basis in recent days. What more can you tell us about the situation there?
So the situation in Singapore is primarily driven by the Delta variant, which we all know that it's much more highly transmissible. And because of that, and the fact that actually Singapore's restriction has been lifted to a certain degree, that people are moving about in the community, infections is happening. What is most interesting is that Singapore continues to chase down to the very last case. We perform very rigorous contact tracing, and we actually test the asymptomatic people as well. And that explains why we have about a couple of thousands of cases in a day, of which actually more than 80% to 90% of them are all asymptomatic with no symptoms.
Right, that is good to know, Professor. Now, Professor, what are your personal thoughts on the COVID-19 situation in Singapore?
It's definitely one that is looking positive. Despite the number of cases, people must be worried that, wow, Singapore experiences 2,000-3,000 cases in a day. But as I mentioned, more than 80 to 90% of the cases actually are people with no symptoms. And if we look at those with mild symptoms, the asymptomatic and the mildly symptomatic explains more than 98% of the cases. So less than 2% of the numbers that we see are actually the symptomatic cases. So by and large, we have vaccinated about 84% of the entire population in Singapore now with very effective vaccines. So things are actually looking great. And right now we're moving towards a step of treating COVID-19 as endemic.
Right. Professor, what can you tell us about the treatment of asymptomatic patients in Singapore? Are they also required to enter a facility, or can they stay at home for treatment?
So if we have this conversation 2 weeks ago, actually the asymptomatic cases, some of them would be in facilities or even in the hospitals if they are of a particular age, like 60 years old and above. But right now, all the asymptomatic cases are allowed to recover at home. And that is a big change in the way that Singapore is treating COVID-19.
Right. And Professor, what has been the impact of having some 83% of the population there fully inoculated against the pandemic?
So I think the biggest impact is really the fact that when we see COVID-19 spreading in the community, by and large, most of the people that are infected actually didn't know that they themselves are infected. But if we didn't perform our contact tracing, many people wouldn't even know that they test positive. But the fact is that we know now that with the use of vaccines, it actually dramatically reduced COVID-19 to a condition that is very much like influenza, like the flu. We see that the death percentages is less than what we previously have without vaccination, and that it means that our death rate is about 0.1% of the people who are infected. That is exactly the death rate that we see worldwide for influenza.
Right. Professor Yik Ying, I understand booster shots are being offered by authorities there since this past Saturday. What are your thoughts on the need or the necessity of booster shots?
So we've seen that data from Israel that actually the protective effects from the vaccines does start to drop, especially after the 6 months mark. And so because of that, the Singapore government have decided to start off by giving people boosters, and those are people who are 60 years and above, subsequently 50 years and above, including the healthcare workers. And on Saturday, the government actually announced that they will allow the boosters to be given to people 30 years and above, provided that they took their second dose 6 months before. So I think this is going to be a necessary step because the world is going to come to terms with COVID-19 through a very careful mix of vaccination, boosters, and actually natural infections.
Right. Professor, do you believe the presence of oral pills like the one being produced by Merck, which my colleagues and I addressed earlier on the program, to treat COVID-19, of course, will mark perhaps an end to the pandemic?
Well, I think we are seeing the tail end of the pandemic in some privileged countries, the advanced economies in particular, because they are able to rely on vaccines to actually boost the immune levels of the people out of COVID-19 waves. But I think the introduction of molnupiravir is going to be a game changer in the sense that now, even if someone is infected, particularly those at the high risk stratas, people who are old, people with underlying medical conditions, they now have an effective form of treatment that significantly reduces the risk of disease and death by more than 50%.
Professor, there is talk about the need to treat COVID-19, as you mentioned, like the common flu. How do you respond to such talk?
I think if we look at what is going to be the long-term and sustainable strategy for countries against COVID-19, it will have to be treating COVID-19 as a form of endemic infection. But when we do that, the question is, are we able to make sure that the people remains protected against severe disease, against death? And I think this is really where we rely on vaccination, we rely on therapeutics like what we just talked about to help to reduce the risk of severe disease, severe symptoms. And that is the long-term game plan, because we will have to find a way to live naturally with infectious diseases, just like what we have done in the past with influenza, with measles, and with mumps.
Right. Then having said that, Professor, for countries that are exploring the option of exiting, marking exit, that is, from the pandemic, what are some of the prerequisites that are needed?
You mentioned, prerequisites in terms of?
To ensure an exit strategy from the pandemic for countries across the world.
I think definitely having the ability to distribute vaccines effectively and equitably is going to help the entire world and not just the privileged countries to exit COVID-19. But equally, I think one thing that is worth highlighting is that it's not just the vaccines, it's not just the treatment, but equally we need people to be infected naturally, but because they are protected by the vaccine from disease and death, the natural infection is going to help to boost the immune level of people such that they are able to resist COVID-19 in the long term.
I see. One final question, Professor, before you leave us. What are your thoughts on Singapore's plans to launch the vaccinated travel lanes with its counterparts from around the world?
So definitely quite pleased to hear that we have a vaccinated travel lane with South Korea. So I look forward to people moving between the two countries. But I think, again, we are starting to see the world move into a phase where vaccinated people are allowed to resume quite a bit of their lives, including overseas travel, whether it's for business or for leisure. And I do see that the vaccinated travel lane is going to expand beyond bilateral agreements to multilateral agreements. But before we reach that, we really need to arrive at a consensus around the way that we recognize vaccination, recognize the type of vaccines that is available in different countries.
All right, Professor Yik Ying, thank you very much for your time and your thoughts.
Thank you.